mentioned, that so many of these chronic diseases, cardiovascular disease, diabetes, and a host of others can be essentially
reversed,
eliminated by, instituting some of these practices in our lifestyle. When you think about the healthcare crisis that we're in, the savings,
the savings would be tremendous. They really would be tremendous if we, as community members, could help each other make small changes. If you're eating this way once a week, twice a week, what a blessing. Small changes over a long time make a big difference. Even if you don't go all the way, a meal here, a meal there does help. And that's what we're after, small changes toward a big end.
Wonderful.
Cheryl, I don't know if I've told you, I have a little personal story of how I changed my diet, and that's probably what got me the most interested in wellness and health. We were talking about changing chronic diseases. We mentioned heart disease and diabetes, and that's always the first thing people think of. But I was told when I was just 28 that I had rheumatoid arthritis. I had some joint swelling, and the doctor just looked at me and he said, "You have rheumatoid arthritis." Wow. And my picture of that was someone in a wheelchair. Mm-hmm. We had a family friend who had recently died, but she spent most of the life that I knew her in a wheelchair, terribly crippled. Mm. And so I was so devastated by that diagnosis. Even though it wasn't so bad then, I felt horrible. I won't be able to do anything with my children. Right. Anyway, I did a lot of research and found that it could be something that you're eating. And so I started leaving different things out of my diet, but I found that if I didn't eat any dairy or animal products at all, I have no pain and no swelling. And so for me, it's so worth it. I would much rather eat all this delicious food. I don't feel like I'm giving up anything, but I have no restrictions in any of my joints, no pain whatsoever. So it's totally worth it. Even if you don't have heart disease or diabetes, if you have some other issues, you may find that going on this diet will make a huge difference.
Wow. And for you as a young woman to have received such a significant diagnosis and to have done all of this research yourself, and now you're a nurse practitioner and you're doing wonderful things in the community. It started really as a result of a personal diagnosis, right, and a desire to have a different outcome. That's awesome. Now, you're doing some other work with Dr. Howe. I understand you've put together a quick little cookbook, and I know our time is running down here, but I'd love to hear just a couple seconds about what it is that you're doing.
The first 2 weeks, that's for the really hard time when you probably don't want to go out. You're in shock and you don't know what to eat, what to get out of your cupboard, throw away, save. There's some fairly simple recipes. There are a few things you need. You need a good blender. You need a silpat. Is that how you say it?
Silpat.
Silpat.
A non-stick thing you can get at a kitchen store. You put in a cookie sheet or a pan so you don't have to use oil on the pan.
Yep. Got it. Yep.
So a couple little things, but really this food tastes great and it gives you a quick, what can I eat? Okay. I don't know if you'd find this recipes in any other cookbook, but that's the first 2 weeks.
Okay. And that's really the first 2 weeks of a
reversal program.
Right. So someone has had a significant event, cardiac or diabetes or whatever.
And a new cookbook's coming out shortly.
Okay, I know. I've been waiting for that. So, all right, this is wonderful. Thank you so much. And I just really encourage you to continue the work that you've begun in the community, because it's going to make a difference in people's lives.
It does. When we all work together, it's enjoyable too.
Yeah, that's wonderful. Thank you for joining us today on Healthy Living. In the studio, Mary Penner, a nurse practitioner working with Dr. Timothy Howe here in Brunswick, Maine. But for those of you living around the nation, I really encourage you to talk with your local healthcare providers. When you're in restaurants, request brown rice instead of white rice, request whole wheat pasta instead of white pasta, all of the things that you can do to make personal choices, and let those choices and desires be known in your community so that we can together begin to move forward towards a different paradigm, if you will, a paradigm where the communities are working together to help support healthy choices. It's not just we as individuals out there struggling by ourselves, but we're working together, we're holding our hands, we're learning more, and we're thinking outside of the box. We look forward to having you join us again on a future Healthy Living program. If you have questions about this show or other shows, I'd encourage you to call us at Parkview Adventist Medical Center, and the number is 373-2162. Again, 373-2162. Thank you for joining us. Thank you for joining us, and we look forward to more healthy days. Take care.